number two first. The oxymetazoline and norepinephrine example shows a potency reversal across tissues of different sensitivity. Yeah, that one was striking. That one led to us thinking about all this, because normally you would expect a progression, right? The curves are shifting and depressing and everything. But what happens is, to a low efficacy agonist, once you get to the point where the efficacy is not high enough to produce response, those curves will come crashing down. So there's no rules to say where this happens. This happens at the actual binding step of the agonist with the receptor. A high efficacy agonist, you always will have this receptor reserve. You're just pushing it, reducing it. It may go from 95%, 80%, and so forth. A low efficacy agonist has no reserve. As soon as you start to push that, you see it fall. You don't often see it as impressive as we saw it with oxy and norepi. One other one, though, that I have published is oxotremorine and carbachol. Same story. So you can reduce the receptors, and oxotremorine, which was a full potent agonist in a sensitive tissue, becomes a full competitive antagonist. And the implication is, as you give these drugs, these kinds of drugs in vivo, they will hunt up organs of varying sensitivity, and you will probably get a mix of agonism and antagonism that you would not get with a high efficacy agonist. Okay, what else do we have? We have one there. Is there a risk of increasing volume control to reveal low magnitude efficacy and also amplify assay artifacts? Do you distinguish a real signal from a sensitivity-induced false positive? Absolutely. All you're doing is modifying your assay. It's like looking at something with your eyes and then putting a microscope to it. You'll see things you didn't see with your eyes, and then the question is, how relevant are those differences? I see it more as giving the systems the chance of showing you what your compound can do. We're often asked in industry, what will this compound do? And the honest answer is, I don't know. But what I can tell you is what it can and can't do. For example, if you could quantify this agonist does not activate GI protein, that's something real. The other things are matters of degree. Okay, if it's sensitive enough, it'll be real and so forth. But I think it is worth knowing these things, knowing the extremes of your compound. The example that we were working with was PAMs. Many PAMs, if you test them in a sensitive system, reveal direct agonism. So you go from a PAM in some tissues to a PAM agonist. They're very different. A PAM agonist is very different from a PAM. Well, it would be good to know this. Similarly, you might ask a question, why do I care if my antagonist is an inverse agonist? Well, you may not. Inverse agonism is not a physiologically recognized signal in most systems, but it also has been associated with desensitization. So you could at least identify it in your compound to be ready for if chronic use of your antagonist, like the H2 inhibitors leads to a loss of effect, maybe that's why. And it can aim you towards a compound that is not an inverse agonist. So it's mainly a question of tailoring the assay to pick up properties of your compound, but you're still may not be sure, will these properties be relevant or not? We'll see. Okay, when a compound looks like a silent antagonist in a standard assay, which is an interesting phrase. What is a standard assay? But reveals intrinsic efficacy in a sensitized system. What does that mean practically for a program? Again, this will be program and target dependent. I'll give you a real life example. We were working at GSK on the CCR5 inhibition of HIV entry. So we had these great sensitive chemokine assays. Our colleagues in Britain had another program for the same receptor, and they really needed to have a silent CCR5 antagonist. They were trying to block chemotaxis. But they knew we had these assays. We had a wide range of assays. So they sent the compounds to us. We tested them in our sensitive assays, and behold, their silent antagonists were very talkative. They did have a low intrinsic activity. Now, it's not clear whether it was enough to cause them issues for their program, but it did help them to know that some of these compounds had that potential, and we were also able to grade the level of this, so enabling them to choose a range of compounds to test in their systems to see if there were differences that they may or may not ascribe to intrinsic activity. So it's a question of just getting an assay to reveal what your compound can do. You're still not clear if it will do it.